You should see Rob shot. Cool. Fair enough. Do you want me to tell you when he's coming, or do you just want to look? Yeah. Yep. Yeah, but he pretty much starts on time. Oh, gosh. Of course you did. Jeez. Yeah. What happened with Tim? Glad you were there? Of course it did. Never fails. He is just outside the door and coming in about 30 seconds.
No, so this morning I went back to the station, said to do a Zoom call
Are we in break?
with this class, and one of my engineers had called me. This is Tony. I had to go, so I was rushing up the stairs to get upstairs. Tripped. I had my glasses. I had my glasses on. Cracked my face, and then screamed my glasses. So that was yes. Yeah. No, don't you want to second glasses? Oh my goodness. I've had it for 2 years. I said, well, it's like a guy money's without me. But still. Yes.
Who wants to spend $700 on another pair of glasses you don't need? Yeah, it looks like my watch is 828.
Man,
What do you have?
that is a rough morning.
Yes.
That never fails.
And I was like, and not to take this. And like, oh, my God, wait for this crack. And he's like, oh.
Yeah. Like, okay, I tripped over your stairs. You're defective.
Literally. And it's just because I go on vacation tomorrow. So,
Oh, of course.
So this is like,
That's what happens when you get ready to go on vacation.
the length.
Yeah. That's when everything bad happens, you know.
You know, all you can do is the best you can do. I'm not that. He is off to the side now. He's probably another one of these ones. First one.
Yeah.
There you go, now you start now.
Good morning. I hate that we are where we are, at a spot where we have a way out of this pandemic, but not enough people are getting vaccinated to stop this latest wave. That we're seeing vaccine hesitancy morph into vaccine hostility, and more young people are becoming hospitalized because of this Delta variant. That we are having discussions about what is the right thing to do to protect the health of others. This is not a Chicken Little situation, folks. The circumstances are dire, and we cannot let complacency or misinformation be barriers to the preventable. On Sunday, the U.S. Surgeon General said that he supports reinstating mask mandates in counties that are having high cases and surges of the COVID Delta variant. On Monday, the American Academy of Pediatrics issued new guidelines for schools recommending that students over the age of 2 and staff wear a mask, regardless of vaccination status. On Tuesday, the St. Louis Metropolitan Pandemic Task Force urged everyone to wear a mask in any public place, regardless of vaccination status, or if the vaccination status of those around you is unknown. The recommendations of the task force include wearing masks, again, for those regardless of vaccination status. While the vaccine can protect against or mitigate symptoms, it does not prevent everyone from becoming infected or passing COVID on to others. Also yesterday, the city and the county health departments issued a joint statement encouraging mask wearing for everyone. This statement said in part that our region is watching national news and trends very carefully, and that we have paid attention to the mask mandates that have been initiated by other local jurisdictions across the country. While we don't have an announcement to make today, this is a topic of conversation, and it's ongoing. For the moment, we urge everyone to wear masks, even if you're vaccinated. And I want to share with you some of the data points that caught our attention. St. Louis County is now averaging 191 new COVID cases a day. Our test positivity rate is 9%. And these numbers mean that we are in the CDC's red zone for widespread community transmission, and cases will continue to rise rapidly in the coming weeks. Black children aged 12 to 15 are not getting vaccinated at the same rate as white children. Data from St. Louis University shows that 47% of white kids have started the vaccination process, while only 16% of black children have begun the process. The pandemic has highlighted the tremendous disparities between races that are often separated by zip codes. This is unacceptable and deeply troubling. That's why we are using many resources as we can on vaccine education and vaccine access, focusing on areas where vaccination rates are low. St. Louis County will be launching a new program, Revive STL, which is a public education campaign, and this will start within the next few days. Public education and advertising has already begun on residents' phones and computers, and you can expect to hear much more about the Revive STL and these messages from local leaders, clergy members, and your neighbors as their stories begin to appear in print, on radio, and on TV. St. Louis County was among the first in the country to put safer-at-home orders in place. Doing so saved lives. Let's work together to make St. Louis one of the first places in the country to get rid of COVID and all of its variants. It's simple, get a vaccine. And if you've already done so, tell your neighbors and encourage them to get vaccinated as well. Wear a mask when you're around others and you're unsure of their vaccination status. Too much is at stake to not do your part. And I'm happy to take any questions.
Dr. Page, what's it going to take in your mind to get vaccination numbers up to where you all have been trying to get them? Clearly it's been a challenge, continues to be a challenge, and with the Delta variant here, it's even heightened. What's the key to heightened vaccinations, do you think?
Well, it's a challenge that we're facing across the country, navigating our way through vaccine hesitancy, which in some places is turning into hostility. And I think that it's a battle on many fronts as people become more aware of the seriousness of the Delta variant, as folks know someone who's been sick or seriously ill or lost their lives. As this awareness increases and we continue to talk more about it, then I think we'll break through. It's a continued conversation, and folks have to weigh the duty and obligation to their community and their friends and family to protect their loved ones from the Delta variant and make the right decision to get vaccinated.
If you go into a place where you know that everybody is vaccinated, would you still recommend everybody mask?
I would, at this time, I would continue to follow the recommendations of our health department and whatever business or institution that you're in. But the question is clarity around guidance for wearing a mask when you know those around you are vaccinated. And the current recommendations from our health department is if you don't know the vaccine status of everyone around you, you should wear a mask. It's really impractical or impossible to know or understand the vaccine status if you're in a crowded place, indoors or outdoors. So I would follow that recommendation very closely. From the beginning of this pandemic, we followed the recommendations of our public health experts in the pandemic task force, and we'll continue to do that. Those recommendations will evolve as science evolves and as we deal with new variants and new fronts.
On a scale of 1 to 10, or even a percentage, how close are we to having that mask mandate reinstated?
Yeah, so the question is about the timing of a mask mandate, and that's a question everybody wants to understand. I can tell you that our health department is, and the city health department are working together very closely, and they're in conversations now about whether or not a mask mandate is the right thing to do for St. Louis County and St. Louis City. We're watching other jurisdictions across the country. We're now in the red zone in St. Louis County with a positivity rate over 10% and over 190 infections a day, new cases per day. So this is a conversation we're having, and it's a serious conversation. And St. Louis County and St. Louis City have always been at the leading edge of the COVID response in order to protect the health and welfare of everyone in our community, and that's why we've done quite a bit better than other parts across the country.
There is a new state law that, if I've read it correctly, if the executive branch put forth a mask mandate, would it last for 30 days and the council would have to renew it after that? Or what are some of the barriers for you to enact new restrictions based off these?
Well,
state
so
laws?
the question is about the new state law and limitations of public health departments to issue public health orders. And so I would just correct the political narrative, Jason. The public health orders come from the Department of Public Health. The political narrative is that they are a function of my office, and we recognize that we live in a political world. But we'll talk to the county attorneys, and if they believe and they interpret the state law to require council approval for something like a mask mandate, then that's what we'll do. I would be surprised if in this setting of rising COVID cases, if the recommendation of the experts in the public health department and the recommendations of the pandemic task force in order to save lives in the community is for a mask mandate, I would be surprised if the council didn't support that.
Dr. Pitt, do you think it's still possible to stop the spread of the variant without implementing something like a mask mandate? Can it still be stopped in time or stemmed at least?
Well, what will stop the spread of the Delta variant is widespread vaccination, and we're not there yet. So the question before us is, can we slow down the spread of the Delta variant in our community enough that the vaccination rate can catch up? So the question before us is not just slowing down the spread of the Delta variant in our community with masks. It's also how fast can we get people vaccinated? Can we get to the vaccination rate that we want to be at? But you know, the question and the dialogue today, and I recognize this, is about a mask mandate in St. Louis County and St. Louis City. But this isn't an isolated question about masks. This is really a question in our community about vaccine hesitancy and vaccine hostility, and how quickly can we get people vaccinated, because we know that's the way out of this pandemic.
If we can't get people vaccinated, what's the alternative here?
Well, we will continue to see a lot of sickness, a lot of hospitalizations, and a lot of loss of life until the Delta variant is stopped or the next variant is stopped. And that's not going to happen until we get our vaccination rate higher than it is today.
So is the purpose of recommending people to get masks to forestall the spread to unvaccinated people? Because the data that I've seen from reputable sources is if you're vaccinated and you get COVID, you're much less likely to be hospitalized and get severe disease. So is this to protect people that are unvaccinated at this point? And that could include children as well, since they're obviously not vaccinated.
And so the question is, if I understand you right, Jason, is why wear masks if you are vaccinated? And what is the point of wearing masks if you're vaccinated? And the reason why the American Academy of Pediatrics, the Pandemic Task Force, and our Public Health Department are recommending to wear a mask if you are vaccinated is because if you are vaccinated, you can still contract COVID, especially this Delta variant. You can still get it if you are vaccinated. Is much, much less likely. And if you do get it and you are vaccinated, the likelihood of you being in the hospital is and being seriously ill is much, much less. But you can still get it. You can still spread it to someone else who may not be vaccinated. And this Delta variant is really a tidal wave in the unvaccinated community when it comes to loss of life and serious illness.
On a similar topic, but somewhat unrelated to this, in the coming weeks, I think the council is going to decide how to spend the American Rescue Plan funds. Can you just talk a little bit about where you would want the council to spend that money, and does your thinking shift a little bit about where that money should go with the rise of the Delta variant?
Yeah, so the question is about the appropriation of the American Rescue Plan funds. And first of all, we have to recognize that this is a 3-year process that allows us to spend the money over 5 years. So 3 years to appropriate the funds to needs in the community to be spent over a 5-year time period, as opposed to the CARES Act funds, where we had initially about 9 months to spend the money in a rather urgent situation. The process that the county used for the initial funding from the CARES Act was for 3 buckets: humanitarian relief, public health, and economic recovery, with priority and focus on North County and primarily the parts of our community that had been disadvantaged and had suffered from health disparities and racial and economic segregation for years. I would hope that the expenditure of the ARP money, the American Rescue Plan funds, will follow a similar path to focus on areas of our community that have been disadvantaged, where health disparities are the largest, where they need the most help. And I would hope that council would focus the appropriations in that area, as we did with the CARES Act funds, recognizing that we have 3 years to appropriate that money and 5 years to spend it. I hope that the focus is on public health. I hope that there is some focus on humanitarian relief. The suggestions I sent to the council were for an expansion of public health services in North County and for workforce development and jobs programs in North County to stabilize the loss of revenue over the past year and prevent further pressure on property tax increases in St. Louis County. And I believe that's the right place to start. It does not by any means spend the entire American Rescue Plan fund, but it is an initial down payment on what I think are the priorities in St. Louis County.
Do you know how much money initially you would recommend spending on that? Because I think it's split into 2 increments. I think the county gets half this year and half next year. Is that correct?
Yes, so the question is about the initial spend of the American Rescue Plan money and how that's allotted to about $190 million. Half of it is available up front, and when those funds are spent, then we would have access to the second half. Initially, the investment in workforce development and a jobs program at the North County Met Center is about $20 million. An expansion of public health footprint and access to health care in communities that are impacted by healthcare disparities is about $35 million. The extra hazard pay to folks in justice services, a small pay increase to the people that work in the jail is $1.5 million or so. The remainder would be to replace lost revenue and stabilize the county budget because of lost revenue from sales tax, and that number is not entirely clear. So I need to talk to our budget director and see how much that would take and how far and how deeply we would go into the expenditure of the first $95 million or so.
I just want to double back really quick. If we're to the question I asked you earlier about if people are refusing to get vaccinated voluntarily, you've seen hospital systems that are mandating their employees to get the vaccine or lose their jobs. Is that something that the county would possibly back in terms of if we don't see any improvements in people getting the vaccine, will we start to make it mandatory for you to have it?
The question is about mandatory vaccines. The EEOC ruled back in November, I believe, that employers can require employees to get vaccinated, and that would be the limit of mandatory vaccines would be employers requiring vaccines. I haven't heard of any conversations about government mandating vaccines, but employers certainly have the ability within federal law to mandate vaccines, and some employers have started doing that, and I would expect that to continue, especially as this Delta variant starts to rage across our community.
Would you start recommending to private businesses that they start checking vaccination status before they let people into their public establishment?
You know, we're not ready to recommend to private businesses that they check vaccination status for their patrons. We'll wait and see where the CDC is on that. But right now, our recommendations are to get vaccinated and to wear a mask regardless of your vaccine status. Whatever recommendations our public health department makes, we'll follow. But I think you're going to see a lot of employers start to encourage their employees to get vaccinated, not just to protect other employees, but also to protect their patrons.
And you might see more employers mandating it after the vaccine becomes fully approved. Would that be a fair assumption? Because I don't think you can, I guess you, I mean, Washington University, for example, is requiring that and before it's been approved, but it seems like a lot of employers are waiting for it to be fully approved before mandating it. Is that what you're hearing as well?
I would refer you back to employers and ask them directly, or ask associations that represent employers what their plans are as a general sense. What I've seen is a lot of employers begin to mandate vaccines with the exceptions of medical contraindications. If you have medical reason not to take the vaccine, then there are certainly exceptions. But in a general sense, I've seen a lot of employers start to mandate vaccines, and I would expect that to continue.
Dr. Page, Channel 5 apologized in advance for popping on a little late online. They wanted to ask a question that Jason touched on. Is the recent state law limiting public health orders affecting the county's ability to reissue a mask mandate?
No, the recent state law does not affect the ability of the county to issue a mask mandate, or the city for that matter. The question for state law is whether or not to sustain that mask mandate would require approval of the county council. And I would just leave that up to the county attorneys to determine. The purpose and intent of the state law was to impact business closures, not to impact other public health orders meant to protect people's health and welfare. Regardless of that interpretation, I would be surprised if the county council would go against the recommendations of the public health department, the pandemic task force, the health systems, and now the American Academy of Pediatrics. In a general sense, when this comes down to the wire, I would expect the county council to do what was right and protect the health and welfare of everyone in the community and follow the lead of our health systems and our public health experts.
And a point of clarification, the positivity rate in St. Louis County is about 9%. You may have said something else if you just wanted to clarify that on the record.
Well, I would refer folks to stlcorona.com for the latest statistics. They change day to day. If the positivity rate is 9% according to the website, then I would accept that number.
That's all I have. Anybody else in the room?
Okay, thanks a lot.